Hi and welcome to JustSalvos Live. I'm Jen Peterson. It's great to have you with us. Today we're talking all about maternal child health, and particularly in the Asia Pacific region. There's up to 230,000 deaths every single year just due to childbirth. And we just want to do something about that. So we want to highlight the issue today. We really encourage you to pay attention to this episode and to then take an opportunity to research at the end and really get involved in this particular issue. All this and more now. Hi, welcome to JustSalvos Live. Today we're talking all about child maternal health, particularly looking at the Asia Pacific region, which is really important. We have a very special co-host for today, Steve Cooke. Thank you for joining us.
Thanks for having me.
It's a pleasure. He's from World Vision, and we thank World Vision for all the work that they're doing, but also for giving us you guys today. Would you like to introduce our guest for today?
Sure, absolutely. I'm sitting next to Esther Indriani. Esther is from Indonesia. She is World Vision specialist for maternal health and nutrition in the South Asia region. And so she does a lot of work in a whole bunch of countries in the South Asia region, like Sri Lanka, Timor-Leste, Papua New Guinea, Indonesia, and helping those countries trying to lift their capacity to help women survive childbirth, to help pregnancies go safely, and help children live to their 5th birthday party.
And is this an issue where you are?
Oh, yes. I'm covering South Asia and Pacific, and it is very significant issues because up to now, we have like around 230,000 mothers die every year, and also countless number of children dying. And we see that the trend now, even though we have made some progress in reducing child death, but we see actually more newborns death. So it's really a big, big problem, and it's really breaking my heart to see these facts every day. Yeah.
I mean, 230,000 women dying. I mean, that's such a big number, and it's nothing like what we experience here in Australia.
Yeah, definitely.
So, what are some of the main reasons that this happens? Why is this such a big number, and how are you addressing it?
Yeah, you know, these 230,000 women die every year in Asia Pacific is already half of maternal deaths all over the world. So Asia Pacific is a very significant pockets of poverty.
Yeah.
Although when we remember about poverty, we will tend to think it's Africa, but actually Australia's neighbors, Asian Pacific, we have a lot of problems. Yeah. So there will be a lot of causes for these deaths in mothers and in children. One will be a significant lack of healthcare for these mothers and children. Second will be still we have problem with low status of women and children.
Right.
So many pregnant women, they are malnourished, they didn't have enough to eat. Same with the children. So there are direct causes, but also indirect causes.
And what kind of areas do you think that we need to really invest in to try and bring about changes here? I mean, there's so many things going on that lead towards these deaths. What are some of the main areas that we can make a difference in?
I believe that everyone has a role to play, right? But one key message that we have to get across is for government, especially government in the countries in Asia Pacific, to put more attention and resources. Because right now, for instance, Indonesia health expenditure by the government is only 5%. For India, it's only 3%. Whereas to make a really big impact and to reduce death, you need at least 15%. So we see that we still need to attract attention from our government. And also individual, we all have a role to play, right? Either health workers, teachers, anyone, they have a role to play because issues of women and children is a complex issue. It's not only from health sector, but it's also related to whether girls receive enough education, whether families get enough food, something like that.
Yeah. So it's kind of quite an all-encompassing issue then, and it's not just something that there's one simple thing to kind of solve this. It's something that communities need to take on board and actually address holistically.
Yes.
So one of the things that I know World Vision does a lot of is around this issue of maternal health and midwives.
Yeah.
Why is there a focus on midwives and skilled birthing attendants?
Yeah. Right now, there are so many women, they give birth without assistance of a skilled birth attendant. And we know that roughly around 50% of pregnancies will have complications. So if we don't have skilled birth attendants ready and standby, then there will be high chance for this mother to die. And when a mother dies, there will be higher chance for the children to die. We have seen these trends, so we have to prevent the deaths in mother in order to save the children as well. So midwives are very important, but what we see in the countries in Asia Pacific, sometimes midwives are receiving lack of support. They don't get enough system to work with. They don't get enough supplies. Sometimes they are put in a remote areas without supervision, supplies. Yeah. So that's why we really need to put attention to health workers, especially midwives, if we want to address the Millennium Development Goals, especially 4 and 5.
Okay. Well, we brought a clip along with us as well that talks about our World Vision's global campaign called Child Health Now. So
yeah, we'd love to throw to that, so have a look at this clip now.
They are my new friends. Same as me, they like to play. But unfortunately, they live in poverty. This is my friend Bunga. If she indeed becomes a doctor one day, she will help all mothers. So there will be no more babies or mothers losing their lives during delivery. Will her dreams come true? This is Ita. Unlike Bunga, she has no dreams. Ita was born prematurely. Her preterm delivery was not assisted by health caregiver, which affects her growth. Ever since, she has been physically very weak and susceptible to illnesses. Now, every day, Ita is struggling to survive. And this is Adit. Adit dreams to be a national swimming champion one day. But there are no clean waters, professional trainers, or swimming pools for him. I personally wonder whether he will survive. I want to be farmer, teacher, nurse, police, kepala desa, arsitek, presiden. I really hope the changes happen for my friends. The journey is still very long. There are still millions of children who have similar fate like them.
There's just some great stories there of hope, and I think that's the thing that sometimes we lose. As much as I want to have hope, though, I realise that we've got 4 years left. 4 years left until we are supposed to reach the MDG, the Millennium Development Goals. Are we going to get there in this area?
You're asking such a difficult question. Like, I think every government in Asia Pacific also asking themselves the same question. it's a very short time to achieve these goals, but I believe that if we really put attention and work into it, then we can achieve this.
Yeah, talk specifically about the goals 4 and 5 for us, if you could.
So MDG 4 is about reduction of maternal mortality, and MDG 5 is about reduction of child mortality.
And so we need to know specifically, I guess, you know, what do we need to do? I mean, we heard within the region we need to be increasing the number of support people during, certainly during childbirth. Can I just say, as someone who's been through childbirth, I would hate to think that there was someone who wasn't qualified, let alone no drugs in the room or having a sterile room. So this is a completely foreign story for those people who are living in Australia, who really hear this story and just have no idea, you know, what you're talking about in a sense of what things can we do here in Australia to sort of help in this horrific tragedy?
You know, Australian community, you can do so much, and I have to acknowledge that Australian government has put so many resources into Asia Pacific. There's a lot of programs, initiatives being supported by AusAid. So what we really want to ask is for Australian people to keep raising these issues, because with only 4 years left, there's no way that we can achieve this without enough support from everybody, including from Australia. And yeah, you can do your part. Like I will really talk to the school teachers to raise these issues, to medical students to understand that this is a problem happening in their neighbor countries. Yeah, so it's everybody's role. And
yeah, it is something that we seem to take for granted a lot, how much access we do have to healthcare here in Australia, and we don't quite realise how drastically different it is in a lot of developing countries like the ones that Esther and World Vision works in.
And I think it's too easy to throw our hands up and say, well, there's nothing we can do, because even if we, you know, deliver the child in healthily, but there's no immunisation and there's no food, and but we can't. We cannot think that way. We must value every life that's coming into the world and treat all of our neighbours with the respect that they need, the help that they need.
And that's why the Child Health Now campaign, I think, is really important, because it is about helping to mobilise communities to understand that we can actually make a difference here. And a lot of the time it is about helping the government understand that we are supportive of this kind of spending. We are supportive of the Australian government helping women in developing countries give birth safely. We do want women all around the world and children all around the world to live healthy and have access to things and the same kind of opportunities we expect for our children here. And that's what the campaign is really all about.
Okay, well, we'll have the campaign details on the website for you to check out, and also on the Facebook. We want to hear some stories of hope. Please tell us a couple of stories that can just, you know, just let us know that there are good things happening.
There are hope.
Yeah, there
are hopes out there. Yeah. So one country that I would like to highlight is Sri Lanka. Sri Lanka has been doing very well in the reduction of maternal mortality and child mortality. So they really try so hard to make sure that they cover the poor. They provide free services to the poor. They make sure that every woman has access to skilled birth attendant. And then one other good thing will be they ensure that girls get education. So around 90% of women in Sri Lanka can read and write. And this is something that is remarkable. It's
Did
not
you say
happening.
90%?
Yes, 90%. And it's not the same thing with other Asian countries. So that's one thing that we really need to strive. There will be 3 main things to do for women. Make sure that they get health care, make sure they get education, and make sure that they get higher status and also work opportunities out there to keep their families.
Thank you so much for coming in and sharing this information with us. But thank you also for the work that you do. And I just am so thankful that you exist and that you're doing this work.
Thank you so much. You're also doing a very good job.
Well, we tried. But yeah, so thank you for joining us on JustSalvos Live. Steve, thank you so much for being here, for co-hosting. My voice is just barely coming out.
But
I really thank you both for the work that you do for World Vision and for everything that you're doing in the field. We'll be back with JustSalvos Live next week, and until then, just stay tuned. Look at all the Facebook, look at the website, Please make sure you're downloading some of this campaign information and checking out some of the stats that we're going to put up there for you. To be educated means that we can make a difference, and we must make a difference. See you all next week.